Good morning. My name is Matthew Stromberg with the Folston Siefkin Law Firm, today's sponsor for this event. I serve as the chair of the Olathe Chambers Legislative Committee, and it's my honor to moderate the Olathe Chambers legislative session update featuring Speaker of the House Ron Reichman and Senate Minority Leader Dinah Sykes. On behalf of the Olathe Chamber of Commerce, thank you all for joining today. Before we get started with today's program, I want to note that we've asked each of our guests to make about a 15-minute opening statement, introducing themselves, outlining what has happened during the first half of the 2021 session, and what they expect for the second half. We will then have a Q&A session with questions collected during our registration process, as well as live questions asked either through the Q&A webinar tool or the chat function. We're also recording today's event, so members who are unable to attend will have a chance to view this event online, and we expect that it will be available on the website later this week. So with that, let's get started. I would like to first welcome Speaker Ron Reichman. Speaker Reichman has served as a member of the House of Representatives, serving District 78 since 2013. He was first elected in 2012 and served alongside his father, State Representative Ron Reichman Sr. in the House from 2013 to 2017. And now we'll do that again this year as his dad was elected to serve out the term for the late Senator Bud Estes. He was elected Speaker of the House in 2017 and has recently been reelected for a third term in that position. Speaker Reichman was born in Western Kansas, earned a degree from Mid-American Nazarene University, and he served on the Olathe City Council from 2009 to 2017. He resides in Olathe with his wife, Kim, and his 3 children. Mr. Speaker, could you give us about 15 minutes of an update on what's going on in the House?
Well, I hope not to bore you for 15 minutes, but I'll give you a bit of an update. Thanks for the opportunity to share. You mentioned kind of one of the highlights last week. My father's coming back to Topeka. He obviously got us straightened out in the House, and so the House was running very smoothly, and now he's good to turn to straighten out the senators. We heard there's some trouble across the rotunda. So you've got my Dinah, you got my dad coming to help you out. So rest assured, everything's going to be okay. You know, this session's obviously a lot of major things are going on. The first is COVID, not just for the way we have to handle things at the State House to keep everybody safe and keep them out of quarantine, but also how we could be there in Topeka to help the folks of Kansas. I can't think of a better time, a more important time, a more privileged time to serve in Topeka than right now. In the middle of this pandemic, in the middle of our economic and health crisis, to be able to take your voice back to Topeka and make a difference. So a lot of things to make that happen. We had to kind of set the Capitol up a little differently than what you're used to. All our committee rooms are separated out so folks can sit 6 feet away. They also can participate by WebEx or by Zoom, our members, and also the rest of the state. And so one of the positive things about COVID is it's really sped up the transparency inside our building. I know a lot of you had participated and taken advantage of being able to not just watch our committee process, but also participate in it to testify and really help guide the policies that are taking place. Our House floor looks different. We've removed about half the chairs. Our galleries are now filled with members. We're all voting from laptop computers. So far, we've been very successful. We haven't had anybody miss 2 weeks or much time at all due to COVID, either from isolation or quarantine. I think there's a lot of luck, but I think luck is obviously when skill and opportunity meet. And I think we kind of have a combination of those. We put in the work to keep the precautions in place so we can continue doing the things that you sent us to do. One of those things is our Kansas Emergency Management Act response, and it kind of put some barriers or guardrails onto what the powers one person can have. We heard loud and clear that we didn't want just one person making decisions, that we want to have checks and balances. And so that's what we're really working on now. Both the House and the Senate have passed various forms of that. That really pushes a lot of the controls to the locals on how businesses may or may not be closed or different things to help guide through a pandemic. One of the things we're struggling with is that right now the COVID's right in the forefront of what we're thinking about. And sometimes we don't broaden our perspective of what it could be for other pandemics. And so we're still working through that. But at the end of the day, we know that the people of Kansas want to have checks and balances. They want to have more than one person making decisions that can really affect our lives. And so that's something we're really working on. Our tax policy. Last year, we were able to pass tax policy that allowed us to take advantage of the federal tax cuts like our surrounding states. That was vetoed. We believe now we have the votes and the people in place to make that happen. And so we could take advantage of that. We also passed a property tax transparency bill that removed the property tax lid, but also makes it very transparent as to what goes forward as far as when your property taxes go up. One of the concerns we heard from our local folks is that the notice was expensive. And so the House version has the state paying for that notification. Unfortunately, this session the majority of the session has been focused on unemployment insurance. You've heard a lot about it. I know you probably are from business owners or even yourself or your employees are hearing about the issues we're having all the way from fraud to folks not being able to get their services. And so we've really been focusing on that. We know it's very difficult for the folks that have been laid off due to COVID who want to work and they can't get through the system. And one of the reasons they can't get through the system is there's so much fraud. And for the last about 9 months, we've been warning the administration that fraud was coming. The business community has led the charge and let the governor's office know that fraud was coming. The federal government has as well. I think we're finally turning the corner, but unfortunately, anywhere from $300 million to $750 million of Kansans' money has been lost, and a lot of that money went to overseas or went to organized crime. And so, not just the fraud that deplenished our unemployment trust fund that we're dealing with, but it's also helping the folks that are in Kansas that have paid into the system that need the help right now. We're working on that. So the House passed a pretty massive reform bill that would help put some of those safeguards in place. It also changed the rate tables, and so your rates won't go up 10 or 30 times what they were. We know it's difficult to own a business, especially during this time. We know with Kansas, our tax policy is not the best. We know we can work on our workforce development, but we definitely want our unemployment insurance to be at a reasonable rate and also be there for the ones that need it. So we're really working on that. Other things we passed was with the House calls working on a Promise Act, which allows one we passed last year. Again, that was vetoed, that we think we can find a way for not to be vetoed this year. That allows businesses to match with our universities and our trade schools and community colleges, the professions that they're looking for. And so it's part of the workforce development that we think is very important to help our state recover. We passed a first-time home buyer program that allows communities or individuals to put money tax-free into account to help somebody move into a community if it's a loved one or if maybe it's a certain trade they're looking for to help grow our economy. And so obviously we've been working on a lot of things, mainly around economic development and disaster relief, and balance it out with all other things we're working on with schools and other taxes and things like that. So we have a lot going on. But again, so far we've been able to do it safely and be able to have your voice heard in Topeka as we continue to work through it. And I look forward to answering some questions and chatting with you, and also hearing what our senator has to say.
Okay, thank you, Mr. Speaker. Next, I'd like to welcome Senate Minority Leader Dinah Sykes. Sykes is serving in her second term representing District 21 this year. She was elected by the Senate Democrats to serve as the minority leader, replacing the longest-serving minority leader, Senator Anthony Hensley. Dinah earned her Bachelor of Arts in Business Administration from Trevecca Nazarene University in 1999. She resides in Lenexa with her husband and 2 boys. Leader Sykes, please take about 15 minutes or so and update us on what you've been doing on the Senate side.
All right. Well, thank you for having me. And I would like to say I'm very excited to get to know Ron Reichman Sr. and work with him in the Senate. So looking forward to building that relationship. I think Representative Reichman did a great job, Speaker Reichman, of kind of giving the overview. My number one priority is to find common ground and pass good public policy. And And I apologize. My dog has just decided he is crazy and wants to play and is growling and running. So my apologies. But being in the minority party, I know, we're not going to be able to pass an ambitious progressive agenda, but I think that there are ways that we can find opportunities in the challenges that we face to continue weather this pandemic and the economic consequences of it. I know Speaker Reichman and I do not agree on Medicaid expansion. It's not a priority of the majority party, but it is a priority of Kansans. So I will continue to push for that. At the very least, Kansas deserves to know where our elected representatives stand on this issue. So continuing to fight for that. Also, protecting public education funding, fiscal responsibility so that we can keep Kansas safe and healthy to grow our economy. I think one of the biggest challenges for me is, moving into this role as Senate Minority Leader. There has been very little turnover in this position. So a lot of those institutional practices, there's an adjustment of that. Of course, we've got challenges, but lots of opportunities for collaborations with members of my caucus, new ideas from my team, new leadership across the aisle. I would say Senate President Ty Masterson and I have a very good working relationship. We don't always agree on the policy, but we are able to, sit down and have those conversations, which I really appreciate. At the end of the day, I think I've put together a strong team and are playing on the caucus's strengths to help us in the long term with our legislative agenda, and of course, expanding my caucus. The priorities, as I've mentioned, it's been Medicaid expansion. Also, adapting to the pandemic. We look at what having a decentralized centralized support and then moving forward. Yes, we want our local communities to take those steps because what's good for Johnson County may not be the same in Garden City. So adjusting to that, KEMA is definitely a big undertaking that we will have this year. And honestly, I'm going to say currently the House version is a little better than the Senate version. Kudos to you, Speaker Reichman. I'm not saying that I love it, but the one thing that I think we've all struggled with is the impact of that decentralized response to a pandemic, which is ongoing, and, the fluid crisis that relies heavily on collective response to reduce the spread. We have to empower our local communities and counties and municipalities. And when it comes to the economic consequences of a disaster that impacts our businesses. But we need to make sure that we do have a centralized, unified response to public health. And we've seen that there's too much room to politicize common sense public health recommendations. And when it's coming from a member of the political party that you disagree with. And so, I think, trying to put that in place. And we haven't had an issue like this for over 100 years. So how could we plan? And hopefully we won't see this again for another 100 years. But how do we put in place, yes, those checks and balances, but making sure that we have the agility to address those issues, on a quick basis. I would say, we showed able to work across the aisle. Was it Senate Bill 88? My numbers, but dealing with the natural gas and those astronomical prices. In one day, we passed good policy and got it on the governor's desk, and we need more of that to move forward. I know Speaker Reichman talked about the Promise Act. It was vetoed last year because we were looking at a budget deficit. And, it's a great program working on workforce development. So excited to have that conversation again. The Senate passed a ridiculous tax bill that would put us in jeopardy. I think it costs $1.3 billion over the next 3 years. We can't pass policy like that and be responsible. We need to protect our budget and protect economic development investments in our state and work toward getting out of this economic disaster that the pandemic has brought. I didn't go into detail of a lot of the bills because I think Speaker Reichman did a great job, but that's kind of the overview from the Senate. It is, a learning process. Like I said, I'm new to this and loving every minute of it, actually. I mean, it's discouraging at times because, yes, I don't have the numbers to talk about good policy, but I think there are those avenues. Like I said, we do have those moments where we can sit and actually talk about what is best for all Kansans and put aside those Republican idea or Democratic idea and look at what is best for Kansans. So with that, I know I'm random and my dog is completely distracting me, but I look forward to your questions. So thank you for having me.
Thank you, Leader Sykes. Now let's move to the question and answer session. As mentioned earlier, we did collect some questions back when folks were registering. We'll begin with those questions, but folks can also submit questions through the Q&A webinar tool or the chat function. Let's get started with some of these. And you guys have both touched on the KEMA bills that are being negotiated, and it seems like there's some differences. Speaker Reichman, do you expect the KEMA bill will eventually get to the governor's desk? And secondly, do you expect that it would be signed by the governor or vetoed if it does get there?
Well, I think we're planning for both. Yes, I know the Senate and the House versions are a little bit different. They both have the idea of having checks and balances. We want to make sure our businesses can remain open. We want to make sure our churches can remain open. Last time when we left session, we kind of had something in place that we thought worked, where the governor can make executive orders and that panel could revoke those or approve. One of those executive orders said that if you go to church, you could be sent to jail. That's not something we agreed with. And so the panel said that's something she couldn't do. She was able to take us to court and basically remove that checks and balance. And of course, a federal court ruled that her rule was unconstitutional, but the state court took away our ability to have the checks and balance. So we hope to have some provisions in that allow for a panel to have the review process, and so one person can't make those type of decisions. There's not a lot in the bill for the governor, besides to have some other set of eyes on there. So it'll be up to her if she decides to sign it. But that does create a challenge for us because we have some of our more conservative members that don't want the governor to have any power. And we have some more moderate members who want her to have a lot of the power she still has. And we have a lot of Democrats who are kind of all over the board on this one. So the ones that talk to me about it. And so we do have a timeline. March 31st is when the current disaster ends. And the current bill we passed last special session also ends on March 31st. And so both sides have a lot to lose. That we can lose the current checks and balances that we have right now, and the governor can lose the entire disaster. And so we need to find a way to work together and make this happen.
Leader Sykes, do you have any thoughts on the KEMA bills?
One thing I think we need to be, like I said, to be agile and make those decisions carefully. One concern I have is that panel, the way, and this is on the Senate version, we had to pull that group together to do an overview of those executive orders within 24 hours. Well, sometimes you don't even have 24 hours. So that's a concern with me, wanting to make sure that we're able to address an emergency in a timely manner. I will say that I don't think the House or the Senate version either has an extension of that March 31st date. And I know in the Senate, most people in the chamber want it to end. I think that's a serious concern because we're looking at, that will take the National Guard away from vaccination distribution, food. So I have serious concerns with that. Yes, we want to make good decisions and have input from all of that. But I will say, in all of those executive orders that our governor has been making, the Attorney General's office has been a part of that conversation. So now when they're coming out saying they haven't been, I think it's disingenuous.
Okay, thank you. And I'm going to actually jump to one of the questions that have just been recently submitted because I think it dovetails nicely on this conversation. The question is, can you share why Kansas apparently is doing so poorly on COVID vaccine reporting? We keep hearing that we are getting vaccines in the arm, but the reporting shows Kansas towards the bottom of the states. And so, Leader Sykes, do you have any comments to that question?
I have lots of thoughts. I think as a statewide, our technology is very lacking. I mean, you look at it with the Department of Labor and our unemployment, we are looking at a system that was put in place before I was born. We have serious issues, and we saw what happens when there is an increase in need for that. I think we are also looking at the same thing on the vaccine information. We are not technically savvy, and that has been an oversight as we've looked at all of these things. As someone who, my family's livelihood is brought on by technology, that is something that I pay a lot of attention to. And yes, we had issues of getting vaccines and then trying to get all of that done. I know nurses who are working overtime just to get those vaccines in the arms, and they're not able to do the paperwork. But I think it's also just our system has not put emphasis on the importance of technology, would be my opinion.
Speaker Reichman, do you have any follow-up to that?
Yeah, Kansans are tired of excuses. And that's what seems what we're getting from the governor's office. We talked about early on, we're trying to get testing to unemployment system to now vaccines. We're one of the last in the nation. I guess from that, there's no place to go but up. I know a lot of logistical companies have reached out to offer assistance, and they're not been invited to the table. We know the importance of vaccines and how to get our kids back to school full time, have zero restrictions, and get rid of the mask, all these things that need to happen. And so a lot of it's just planning and preparation. We were asking these same questions privately and publicly all year, knowing it was coming. And we're continually being told that it's taken care of, it's taken care of. And then when the rollout happens, it's not. And so I know I'm tired of it. And I'm tired of people calling us and want us to help. Obviously, we want to help them the best we can, but we're mainly oversight. We don't get to actually make the decisions, especially when it comes to unemployment. My phone in my office rings nonstop with folks who are trying to get into the system who need help. And same thing with our emails. And it's just, we've spent almost $50 million on a call center that was a no bid contract that was outside of the state. We're hearing we're finally going to hire about 500 more folks. We're hopeful they're trained because, again, we need to do this together. We need to find a way. I know our office is willing to help whatever we can. I know the leader's office is the same way. We got to find a way to just move past this stuff and find a way to actually get the folks their unemployment checks, to stop the people from stealing the unemployment money, and also to find a way to get the vaccines in people's arms.
I just want to add, I think this is what happens when we don't have a centralized system and we talk about, the governor making those decisions, and then we tie our hands and we want locals to make that decision. This is a direct response to small government.
Thank you both. Moving on, can you explain the COVID business liability bill and how it will help Kansas businesses? And I'm going to let Speaker Reichman address this first.
Well, I know that last year, we wanted to make sure, or last summer, we wanted to make sure that folks could get back to work, but we didn't want them to have all the liability of somebody coming in and not knowing exactly where they're exposed and causing businesses not the ability to open, to be able to pay their employees, provide a service, and ultimately provide revenue back to the state. And so that's basically the concept, is that folks, as long as they're taking normal precautions, that's not something they'll be liable for. We were able to put that provision in our bill last summer. The one we weren't able to put in is for our nursing homes, and the House just passed a version of that this last week that allowed, again, as long as folks are using normal precautions, they're not to be held liable for things they can't control, because we want to be able to get in our nursing homes and see our loved ones. We also want to be able to go to the store and operate and not have unnecessary liability for things that the business owners can't control.
Okay. And Senator Sykes, do you have any follow-up on that or thoughts?
No, I absolutely agree. We should be protecting our businesses, especially when they're taking the steps to protect their employees and their clientele. I will tell you, and being completely upfront, I voted against this bill on the Senate side on Wednesday. I felt like it was rushed through. I am someone who likes the process to work, and this bill was introduced, I think, at 5:00 on Monday evening. It had a hearing the next day around lunchtime, and then we were voting on it on the floor. And I didn't feel like we had enough information. It was extending that date, but we didn't have any issues that this was a problem. So I hope, as the House passes and then we conference or whatever, we can come to some sort of agreement on how to make sure we are protecting those businesses, but also making sure that we're protecting those who maybe individuals who do have a valid concern there. And, letting the process work has always been my biggest desire.
Okay, thank you both. Next question, I'll start out with Leader Sykes. I know you both have different views on this issue, so I'll just see what you have to say. Will Medicaid expansion be debated this year? And if not, why not?
Well, on Wednesday, I actually brought an amendment. Honestly, I didn't think it was going to be germane to the discussion, and I was surprised that it was germane. So we had a mini discussion on the Senate side, and we did not get the votes that I had hoped. There were 12 votes, so 11 Democrats and 1 Republican voted for it. We had several members who did not vote or were out of the chamber at the time, which I do believe are supporters of Medicaid expansion. My hope is on the federal level, where they're looking at some of those changes, trying to incentivize, giving the carrot for states who have not expanded. I think Kansas could be looking at over $300 million in money from the federal government over the next 3 years if we do expand. So I hope that we can have that conversation in committee so that people feel more comfortable. I mean, we do have quite a change in turnover in the Senate, so there are some who have not been a part of that debate in the past, but I think it has thoroughly been vetted. And, I would like to see a really good discussion on Medicaid expansion.
Speaker Reichman, your thoughts from the House perspective?
Sure. I think when you watch what happened in the Senate, when they had 12 votes, needing at least 21, it kind of shows the folks where at least the Senate is. The House in the last couple of years has passed a Medicaid expansion probably 3 different times. The elections we had last August and last November does have fewer people supportive of expansion. I don't believe it would pass the House at this time either. Some of the things we've been working on is we hear a lot about how it helps rural Kansas. And so we have 2 different programs we think it really help our rural hospitals. One of them is a way that basically allows our hospitals a way they get to bill things to show more of emergency, and so they can actually get a different rate from their insurance and the medical programs or federal programs we have. The other one we're really excited about that combines state and public dollars and private dollars to help right size some of these rural hospitals and find out what their actual services are. Another thing we've really been focusing on this year is our telehealth. I think especially during the COVID time, we saw how important it was. And so we've been really focused on things that we know have a chance to get to the governor and try to provide better access for all Kansans.
Thank you. This one just came in from one of our attendees, and this sort of gets back to that idea of, maybe what led to some of our UI fraud cases. It says, poor quality services services is rampant all over our state government. What is the legislature going to do to ensure we invest in IT and secure our state resources? And I'll start with you, Speaker.
Yeah, we, in fact, the unemployment bill that we just passed designated a lot of money to our UI system to be revamped. It also has a panel that will oversee it. And so there's more accountability to the process so this doesn't happen again. I think we go back in time, I believe the Civilian Administration had $30 to $40 million that was to help revamp this. And they produced a report to the Brownback administration. I don't think anything really happened with that report. I know the funding wasn't attached to it. We're very aware of the situation now. I know the House has approved every single request that the governor has asked for the department over the years for either IT enhancements or for staff. And we also know when we're going to shut down businesses last March that this problem was going to happen. And so we're excited that we're finally taking a strong look at this. We wish it would have sped up by about a year or two, but we don't have a time machine. We can only move forward. And the House bill was just passed, provides the oversight, the accountability, and also the funding to fix the situation.
Okay. Thank you. Leader Sykes, do you have any thoughts?
I have served on the Joint Committee for IT for the last 4 years, and yes, pay in the state for IT professionals is a joke. You're not going to get people who are going to lead the way in this. I look back to last summer when the U.S. Department, all of those IT professionals came in and they were helping. I think we were better off there because we actually had high quality, high paid people who were volunteering their time to help Kansas. And I think part of it, we don't have a lot of people in the legislature who IT is their profession. They don't know how that works. We look at even the process to upgrade something, and the chain of command to change something is valid. There are reasons. We have a long list of hoops that people have to jump through, but it doesn't make the process work very well. I mean, we look at transportation and the design build and how that helps us save money, get projects on in a timely manner. We don't do that in IT. And so we start out this plan, and then 3 years later, we're still filling through that plan. We don't have a lot of agility in there. And so I think we have to change our approach to IT. And, if we don't have the legislative expertise, we need to go out and get the technology people to help us direct this and not try to do it on our own. We're not doing this in a day-to-day. So I think that is part of the process. We're trying to do something that we are not equipped to handle and needing to have those conversations with experts in the field.
Thank you. The next question, I'm going to go back to something you guys spoke briefly about earlier. Can you elaborate on Senate Bill 88, the bill that addressed the surge in energy costs last month? I mean, that was something that sounds like you guys got through pretty quickly. Can you give us a few of the details?
Yeah, sure. It's like, what else is going to happen this year? We have this started with the COVID crisis, and then we had obviously we had some security issues at the Capitol. Then we had this cold snap here, or streak, and the supply of natural gas really got limited. A lot of it got choked down based on the frozen conditions of the pipes, the wells, and also demand. A lot of the coal that was being burnt was frozen on the ground and couldn't be utilized at the rate it needed to be used. Besides the stuff coming right off the trains, our solar and wind, they were working, but not at a rate that can handle the type of long-term coal that we had. And so it's an energy crisis for the entire state. As you noticed, that we actually had some blackouts. It's because the power grid we're on, we share with 7 other states. And so they kind of dictate who's going to have power and who doesn't. Unlike Texas, who has their own system, and they have a lot of issues now. So we're in a better place than others. But what happened to a lot of these smaller communities, about 150 of them, they only relied on natural gas, and they might have a budget of $7 million for a year. But a unit of gas, natural gas, went from $3 up to over $600 a unit. And so we saw prices that would have 100 to 1,000 times increase. And so the cities themselves could not pay their gas bills. The first thing we had to do is make sure that the gas can remain on to the smaller cities, and so they can have power for the businesses in their homes. And the second thing was, how can they help pay their bills? Like us in Kansas City, we have Evergy. They'll be able to take our increased cost. Of course, they're able to offset a lot of that with coal, and they'll be able to offset it over time with the resources they have. But some of these smaller communities do not have the resource. They just have the cash they have on hand. We're only using natural gas that went from $3 to about $600. And so what we did is we took our idle funds and $100 million and said that the towns can borrow that money and pay it back over 10 years at a small rate, so they can smooth out their energy cost and not have prices go from $30 a month to $4,000 a month to their homeowners, which, a lot of folks wouldn't even be able to pay the bill if they got it. So it was, like the leader mentioned earlier, it was a time when we all worked together. The bill's introduced on a Tuesday. We had a hearing on the a House committee Wednesday morning. A lot of you hear the nasty term gut and go. This is a time when the gut and go was very useful. We took a Senate bill that wasn't as high as a priority and inserted the contents of this bill that allowed for these small interest loans. And then we put it right to the House floor, and they sent it right up to the Senate. And I think we had a hearing at 8:30 a.m. and the governor signed it at 8:30 that night. And so it truly was something that we put our heads together and worked together to make it happen. But it truly was a need for a lot of our smaller cities that really were put in a bad spot.
Thank you, Speaker Reichman. Leader Sykes, do you have anything further to add?
Yeah, no, I just, our municipal gas, they kept us updated all along during this cold snap and working, because they were seriously concerned about, paying the bills and looking over that Martin Luther King holiday. They spent their entire annual budget on gas for 3 or 4 days. So, I think Speaker Reichman did a great job of talking about the bill, but it is truly when we put aside those partisan things and put forth what is best for Kansans. So it was a good day in the Kansas legislature.
Well, that's always encouraging to hear. I'm going to jump to a quite different topic here, and I'll start with you, Leader Sykes. Do you see medical marijuana ever passing in Kansas?
I have so many constituents who email me about this. They have been emailing me for the last 5 years. Honestly, I don't know exactly where the votes are in the Senate, but I have always said, this needs to be something that is debated on the floor so that we can have this conversation. Before I was elected, I think in 16, maybe it was 15 or 16, the House passed medical marijuana and it died in the Senate. I have never been able to have that conversation. And I think, we are waiting to be one of the last states. And I think that is a serious issue for Kansans. It's better to be further along than the last state to pass something. And I think that's kind of where we are right now.
Speaker Reichman, do you have any thoughts?
Yeah, we have a bill in our Fed and State Committee that they're working through now that does provide for medical marijuana. The version it doesn't have combustible, so you can't smoke it. It's more things in edibles and things like that. We know the governor came with a plan that combined medical marijuana with Medicaid expansion. Those two things really aren't compatible. If you did have a prescription from your Medicaid expansion policy, the government couldn't fill it because it's not a lawful substance. And also they're just not germane. But I think it kind of hurt both camps a bit because a lot of folks, well, there's no way I'm going to support medical marijuana because it's tied to medical, it's called to expansion, or the other way around. It won't help expansion because I'm so against medical marijuana. So we'll keep them separated in the House. And we'll see how it comes out of committee. But I have a feeling if it was on the House floor that it would pass. It just has to get through the committee in the right form.
Okay, thank you. All right, so this one, bear with me here. I'm trying to read off of a phone what the question is. Healthcare providers are seeing an increase in mental health cases. Closing state hospitals and reducing programs has created a donut hole for these individuals needing mental health services. Are there conversations expanding mental health services for Kansans? And I'll start with you, Speaker.
Yeah, we formed a committee that dealt with this, we call it interim committee that meets when we're not around. And they came up with all kinds of great ideas, and we'll continue to allow them to meet. They broke out into all kinds of groups. We're finding that there's a lot of kind of duplication of services, a lot of folks trying to help out. And so we're trying to unify some of those inside our counties and also provide the funding. We have programs inside our schools. The pilot program is working very well. We have a program now to help a new phone number, 988. And so you call that instead of getting the emergency police or fire operator, you'll get somebody who's trained in mental health. The debate we're having now is where that call goes. Does it go to trained EMTs and police officers? Does it go to certified folks that can help you with just some mental health? We know this is a big issue. It's one that we've been very important to a lot of us since we've been in Topeka. COVID has just highlighted that. We're meant to be social people. We're meant to talk and interact with folks, and to be sheltered and not around people has not been healthy. Even the fear of being unhealthy is causing people more unhealthy. Also, the fear of not having stability for food or jobs. And so we know it's very important, and we've been working very hard on it. Our health chair, Representative Langware, this is near and dear to her heart, and she's put a lot of time and energy into some programs that will help us out here in this area.
Leader Sykes, do you have any follow-up?
Yeah, I have always been a strong advocate for mental health, co-sponsor and supporter of mental health parity, and making sure that we look at our mental health just the same as we do our physical health, making sure that insurance companies provide that care or the support and payment for those. I always go back to Medicaid expansion. Johnson County alone, we have $7 million in uncompensated care through our mental health. If we expanded Medicaid, $3.5 to $4.5 million would come back to our state for that. So if we had half of that, then we could expand that care. These are dollars that we are leaving on the table when we could help more people.
Okay. I'm going to jump now to education, and I'll start with you, Leader Sykes. Is there any budget issues that are going to be addressed around schools this year in the session, or is there any concerns about cuts or anything like that moving forward?
It will remain to be seen. I mean, we have seen bill after bill expanding tax credits and such. On the House side, I will think their K-12 budget committee has been very interesting, to say the least. We look at, we're getting federal dollars. There has been lots of conversation with people that we can use those federal dollars instead of using our finance formula. I think that is a serious mistake. So I think this, as we go back on Wednesday, I think education is going to be more of an issue that we're discussing. And I think it is being attacked and trying to divert dollars. So we will see. I know our Senate Chair, Senator Baumgardner, was an advocate for our funding formula several years ago and went against the House as we were trying to push that forward. So I hope she continues to maintain that support as we are moving forward, because we are finally funding constitutional levels. I mean, we still have a couple of years to get to the level, but we are on the path. And so I would not want to do anything to jeopardize us and put us back in court.
Speaker Reichman, what are your thoughts on the school budgeting moving forward?
Yeah, I think we have to be responsible and look at all accounts that we pay. We look at all the funds that are coming in. We're responsible for more than just K through 12. Right now, our higher education is needing additional funds. We talk about workforce development. We think it's very important. I think early childhood is also very important. We talked about mental health and what it costs for that to happen. It hasn't come up yet. It probably will on this call on what happens with our KDOT funding and what happens with Highway 69 and Highway 10. These all things take funds. And so we're not just elected just to look at one half of the budget. We're supposed to look at all of it. The courts did give us direction, and we have a bill that does pass. It does not say it has to be just the money that came from your sales tax and from your income tax to the state. So we're trying to balance out all the funds. One thing I am certain of, if we all work together, all industries, and we find out what we need, not just what we want, we can get through this, and we can have money to provide our core functions of government. So we're keeping an open mind on how to do things. I know a lot of us heard over and over from our parents that are frustrated that their kids are at home. They're frustrated they can't go back to work because they're at home. They're frustrated that they're not being taught virtually. And so we need to be accountable to our parents as possible and make sure our kids get the best education they can. At the same time, be accountable to the tax money that's coming in.
Okay, thank you. This one was one that we had received previously, and this kind of jumps back to COVID. As you can imagine, I've got a number of COVID questions that I've been requested to talk about. This one says, I work in a hospital with acute COVID patients, and now we are seeing post-COVID patients. What is being done at the state level to address coverage for this diagnosis, as well as informing the public? I think some people who have had mild COVID may be sick down the road and not understand that it is COVID related. And I'll start with you, Speaker Reichman.
Well, COVID does affect people differently. Some people, they don't even know they've had it. Some people, they lose their taste. Some people think it's a small flu. It put me in the hospital for a while. And so it does discriminate how it does treat people. And we don't know the long-term effects. And so I think a lot of that's education. A lot of that's just folks being patient. And so I know the medical industry is working very hard to find solutions and come with new guidelines and new therapeutics all the time. But I think the question might have been on insurance coverage. I'm not for sure. I know a lot of policies would cover COVID-related things for a time period. They're all over the place. I don't know the status of that right now. And lots of times, too, it's the hospitals and the doctor's office make sure they're coding it so it's COVID-related to be able to get that insurance company to pay for it. But no, it's a concern. We don't know the long-lasting effects. I'll just share with my son who got COVID at college from his roommate, and he's on scholarship to play basketball. Didn't have a single symptom. He came home for 2 weeks. Before he returned to activities, they did a test of his heart, and it showed that it was inflamed and infected, and he missed 3 months. And I'm very fortunate that he was in a school that tested his enzymes and showed he was elevated. Most Kansans and most people with COVID aren't taking those tests, so we don't know the long-term effects. But it does treat people differently, and so it's a great question. I really don't know if I have the answer for it.
Yeah, thank you. Leader Sykes, do you have any thoughts?
Yeah, I would say, this is a new virus. We don't know what the future holds for it that changes. My own sister-in-law has had some issues, and she went in and they said, oh, you've had COVID. That's why your lungs look like this. So we are still learning. And I think that's why we have to be cautious. And when we're saying we want everything to go back to normal, things are not going to go back to normal. We are in the middle of a pandemic. And yes, I want my kids in school. My son is a senior right now. I mean, his senior year has completely been disrupted. But I also see how my kids have adapted to this situation and how, the things that they have learned over the last year has been incredible, and it will make them be better leaders moving forward because they don't have to go back to exactly how things are. And yes, online education, virtual school was not their first choice, but they have thrived in it, and they have taken all of that as a grain of salt, and they're looking at, okay, this is not a political issue. This is a public health emergency. And looking at it that way, I think we will, do better off. I currently, or this summer, read about the 1918 pandemic or the virus. And, reading that, I don't think we learned very much from that. And we were still having those same issues on this pandemic. We don't always learn from history. And it's, how do I put aside my own self-interest and look for the good of those around me? And, it's been disappointing. I don't like wearing a mask, but, if it's going to keep someone else safe, we have to do that. And I'm probably not answering your question any more than Speaker Reichman, but we are in the middle of a pandemic. And I think we have to put public health at the forefront and adapt. And I look at all my small businesses, how they've adapted to, restaurants outside, online shopping where I just go and pick up. We can adapt and we can be better. And we've looked at how society, really some of the issues that we knew were issues have just bubbled to the top more so. And I think we as a society can address those and be better off in the future, or we can say we're just going to go back to how things were before.
Okay, thank you. We're pushing an hour here, so I'm going to do one more question, then have you guys each just make a brief closing remark. The final question was submitted by one of our attendees. How much do you expect Kansas to receive in federal assistance with the new round of stimulus, and how will this money be spent in Kansas? And I'll start with Leader Sykes on this one.
I do not know enough about the bill that passed to give you a great number of what we are to expect. I think my hope is that we look, how do we help those who are at most need, those businesses, but also individuals that have been hurt the most? How do we set ourselves up for success and look at some of those inequalities that we have seen, and how do we address these? And, I know it can be done, but the process sometimes is ugly, but we don't always let the process work. And I think that's, what we need to do as we're discussing moving forward. And, instead of saying, whose idea was this? And do I like that person, or do I like their philosophy? But really open up and have those questions, have the dialogue. And at the end of the day, it's not if it's Senator Sykes' idea or Representative Reichman's idea. It's how does this benefit Kansans as a whole? And that's what we should be looking at.
Speaker Reichman, you want to follow up?
Sure. If this last package that was passed, it's over $6 trillion in one calendar year. The federal government brings in about $3.4 trillion. We spend about $5 trillion on everyday things. And so the deficit spending is unbelievable. I was talking to Congressman Estes this morning. He thinks there may be 2 more packages coming yet this year. And so we're already bringing in about $3 trillion and spending about $11 trillion already this year. And so we really need to be cautious in what the money but how do we take care of the money that we've been sent back to us? The House has already tagged that $450 million of it go back to repay the unemployment trust fund. I would think there'll be about $1.5 billion that comes to Kansas. Hopefully there's less strings attached this time as last time. And so we can put it to one-time things. And not long-term, not fund programs that begin and don't have federal funding long-term. And so we'll see what happens when we get the funds. Again, we think our CAPER system may be a good place for it. Our unemployment trust fund will be a good place for it. And maybe some other one-time opportunities. We'll look for those as well.
Okay. Well, first of all, thank you both for answering everybody's questions today. Speaker Reichman, if you just want to briefly have a closing comment, be my guest.
I appreciate the time and have the discussion. I think I agree with Senator Sykes, and this is an opportunity that you sent us to work together. We want to find ways to work together. I think there is some good that comes out of COVID, and we look for those. She mentioned how her kids, how they're being more flexible. I think we all need to learn that lesson as well. I pointed earlier to the fact that the State House is more transparent, more open, more technologically friendly. I think our businesses are doing the same thing. They're learning how to be more efficient with their office space, with their travel, with their meeting time. And so I think we continue to look for positive ways, and Kansas will come out better through this than when we started.
Thank you, Speaker. Leader Sykes?
Yeah, thank you again for the opportunity to speak with you. And I just want to take a moment to publicly say thank you to Speaker Reichman for all that he did to help make the Capitol a safer place. I think the House is probably a little safer than the Senate, but we're adapting. And even in the process, we have even adapted in our committee. But I think he really set the stage for that. So thank you, Speaker Reichman. Regardless of how we get to the policy, we want the process to work. And I think you don't want someone putting their thumb kind of changing the way the scale is. And the transparency that COVID has brought, I am very thankful for. Continue to work with everyone to, make Kansas a better place to live, raise your family, and work. And so look forward to talking to any of you if you have questions. My office is always open. But thank you again for having me.
All right, thank you. Well, this concludes our 2021 legislative session update event. On behalf of the Olathe Chamber, I want to thank Speaker Reichman and Minority Leader Sykes for being with us today. We appreciate your leadership and all the time and talent you both share with the state of Kansas. Also, thanks to the Folston Law Firm for sponsoring today's event. Reminder, the forum has been recorded. We will be posting it at the Olathe Chamber website later this week. And finally, I'd like to thank everybody for joining us today and taking time out of your busy schedules to learn about what's happening in Kansas and at the State House. Thank you, everyone, and enjoy the rest of your day.